to remember how important that liver detox is. Remember I talked to you about that, very important, because you don't only sweat it out, you also mobilize it and have to get it out through the liver through that twofold process where you oxidize it, make it more sticky, you call them the legal escort service, get it out, okay? You remember that. Now, chelation therapy, I'm going to end with this, okay? So, got 7 minutes. I think it'll be a good time. Chelation therapy, if I take an extra few minutes. Thank you. I just got permission, Dina, so sorry. The survey, the Autism Research Institute does surveys of parents, just like yourselves. They say write in, and you can write in the treatments you've done, and you see, like you take a drug like Risperdal, you take a gluten-free diet, or a gluten-free casein-free diet, or vitamin B6, and you say improved, not improved, worse. Very simple. They've done over 20,000 parent surveys. Not double-blind, placebo-controlled science, but nonetheless helpful. It gives you some information. You put that together. And chelation therapy, which is the most controversial treatment in mainstream medicine for the kids, and I know it's frowned upon here, and it's frowned upon, unfortunately, in the States as well, but for those of us in the field, we know how much it improves kids on a regular basis, many kids. Not without potential side effects, so you have to be trained in this, and we train doctors in this. I'll talk about that at the end of the lecture. But approximately 73% of the parents, of the respondents stated improvement, the highest percentage in any treatment, diet, supplement, medication. But this, not all 20,000 chelators, so I don't know how many hundreds or thousands they were, I don't know that often, but it was the highest percentage of improvement. The process of heavy metal detox is a lengthy one. It must be done safely as possible with proper monitoring and supplementation. And that's the key. It has to be done with someone who's well trained. You should not be detoxifying with someone who does not know how to, especially pharmaceutical detox. It requires appropriate attention to the gastrointestinal tract and mineral status. It requires patience on the part of both the parents and physician to sort through potential exacerbations and a possible up-down type course and allow the time necessary for its optimal effects. And this is one of the problems is sometimes I see, and I do have to say that I think, and this is not any bias that I have, but I think from a cultural perspective, sometimes there's a wish to have it done too fast. You want it done yesterday. Not you, just, I'm saying the generic you. I mean, it's in the States as well, but I think there is a cultural thing here in Asian culture that really wants results quick, and I think it's unfair to yourselves and your children. So you really have to temper that with this thing that this, especially if you have to detoxify, it's a lengthy process. And safety first. Safety first. Safety first. This is chelation. Chel comes from the Greek word claw, which means to latch onto. So it latches onto a metal ion and escorts it out through the kidneys. Classic chelators bind a metal into a ring structure. I'll show you a picture of that and neutralize its reactive state. Thiols are the ones that contain the sulfur. So calcium EDTA, and again, it's very important that it's calcium EDTA, because sodium EDTA has been responsible for at least one death in a kid when it was inadvertently given as a push. We use sodium EDTA, disodium EDTA, when we treat heart disease. It's an alternative method for treating heart disease, and it's part of a big study in the US that's coming near completion. Almost 2,000 people being treated with disodium EDTA. But for the kids, you use calcium EDTA, because disodium EDTA can deplete the calcium levels and cause arrhythmias. DMSA and DMPS are the two other chelators. I'm just going to show you pictures of them. This is EDTA. This is DMSA. See, remember I showed you glutathione had one? This has two of these sulfhydryl groups. Think of how tightly it can bind on to the heavy metal and bring it out through the urine. This is EDTA, and what happens is it grabs it around in a ring-like structure, very tightly, and takes it out. That's a pure chelator. And this is DMPS, again, the sulfhydryls binding to mercury, okay? DMPS, just so you know, DMSA and calcium EDTA are FDA approved in the States for lead toxicity. Most of your children do not have toxicity from blood, so they don't meet the criteria. So they have these what we call heavy metal burdens. They have too much in the tissues, but they don't meet the criteria for toxicity. So there's off-label use. The only on-label use of drugs for autism are Risperdal and now Abilify. Every other drug we use is off-label. So we have patients sign informed consent, and we make them know this is off-label. DMPS has been used in Russia and Germany with a pretty good safety record, but DMPS can, but it's not FDA approved. I think it's a problem in this country, so we can get it from compounding pharmacies in the States. I just want you to be aware of it, okay? And there are potential effects from DMPS and DMSA. You know, allergic reactions, quote, skin rashes, low white counts, elevated liver, fatigue, headaches. You have to be aware of these things. That's why you have to be monitored. And with DMPS, there's a potential very severe skin reaction called Stevens-Johnson syndrome. This is a case, but very, very infrequent. So generally, they're pretty safe, but you have to be respectful of the possible side effects. If you see a really bad skin stuff, you can't say, oh, it's a die-off and keep on going on. The doctor has to know, uh-oh, we got to pull back with all these things, okay? There's always a risk-benefit. We always try to weigh out the risk and the benefit. Oops. Okay. And with, we do urine, so because it's not in the blood, we do a urine before, we give a chelator, and then we do a urine after, and lo and behold, a lot of times you'll see excess levels of lead and mercury and the arsenic. And these, although they're not toxic by blood levels, they have heavy metal burdens. And you watch as you chelate them slowly over time, the gradual protocols that your doctor needs to know and be trained with, these gradually decrease over time. That was with DMSA, and this is calcium DTA. This is a huge lead level. This kid took years to come down. And although calcium DTA doesn't typically do mercury very well, when it's so high, it sometimes will as well. So remember, we have to think about mineral status, because it takes out good minerals as well as the bad. We have to think about the gut when we do chelation therapy, especially with the sulfhydryl, the DMSA and DMPS. And we have to give antioxidants because the heavy metals cause oxidative stress. So vitamin C, vitamin E are important. NAC can help the DMSA work better and restore the redox, okay? Curcumin can also reduce the lead-induced neurotoxicity along with chelation. So there are other things in addition to the chelators that can help deal with the toxicity. Curcumin is a very, very good, powerful antioxidant and anti-inflammatory. Okay, I'm just about finished. Okay? So, medications. Well, I got to do 2 minutes because I told one of the doctors I was going to talk about this, so then I'm going to, okay, I'm sorry, I forgot about that. Make sure I did. Anyway, there's all kinds of medicines that can be used. Behavioral medicines, when a kid is really, really aggressive, or self-injurious, we have no choice. Sometimes we have to use a medication because it takes time for this program to take traction. So this is not only natural. This program is totally integrated. Medications, but sometimes antifungals, antivirals, anti-inflammatories, immunomodulatory hormones. It's totally integrated with behavioral therapies because the essence is we want to make the neurons work better so they can respond that much faster and more completely to the behavioral therapies. This is not either or. This is truly integrated. Medicines, diet, supplements, detox, and behavioral and educational therapies, and clinical therapies, OT, speech, all right? Yeah, O2 maybe somebody said, right? This is an example of a PPR, it's a big word, peroxisome proliferator activated receptor agonist for neurological disease. This is talking about something called Actos, which is a medicine for diabetes. But it turns out what happens is in some of these other neurological diseases, Alzheimer's and multiple sclerosis, they're talking about upregulation of these glial cells. Remember I said those immune cells in the brain, the microglial cells, are upregulated. Well, what is this PPAR activation, which can be done with nutrients like the DHA, one of the omega-3s, and Actos, one of the medicines? They can down-regulate the upregulated glial cells. And the glial cells are making more and more inflammation, so if you can down-regulate them, that's good. So this is where Actos, which is for diabetes, we use in some of the kids, and it works. It's an anti-inflammatory. And it's being researched in other diseases as well, neurologic. And this was just a small study showing its effectiveness in autistic kids. But this set doesn't really have many side effects. It can have side effects. It's not supposed to produce low blood sugar. Any of these things can produce agitation, hyperactivity, irritability. I don't care what they say. It happens. You have to be aware of it. And it's also been looked at in asthma, another inflammatory disorder. Activation of the PPARs. Okay? IVIG, an immune modulatory treatment for kids with PANDAS. We do a lot of IVIG in my office. It's very intense therapy. It's very expensive. It takes 5, 6, 8 hours in the bigger kids. But if they have an autoimmunity to the brain, or they have immune deficiency recurrent infections, it can be helpful. So you have to pick the right substance. This is not something you would jump to. This is a major intervention that we only do when we really need to. Hyperbaric oxygen is controversial. Some parents swear that it helps. There have been a couple of small studies that have shown it helps. There's been a recently pretty good study, also small, said it didn't help. I think the final word is out. It may be that you need more time in the chamber, more oxygen, more pressure. We don't know yet. But I just want you to be aware that there's potential here. It's not been proven. It's expensive. So again, this is one of those whale watching things. I'm not saying it can't help your children. I think you got to be aware that it can make them more stimmy and make some problems. So we just got to recognize that. And again, and lastly, oxytocin. This is one of the hormones. It's one of the hormones you make after you have a baby. It's the binding hormone. And there's a couple of small studies that have shown that oxytocin can increase social cognition, the ability to recognize facial cues, pick up on social cues, increase social interaction for some of the kids. It's being studied more. There's some further studies being, these were usually in adults or young adults. There's some studies that I've been actually consulting with one of the researchers from Duke and other schools looking to start a study in kids. But it's very promising. So, conclusion. The 4A, I'm 5 minutes late, but the 4A disorders are linked together by the commonality of genetic vulnerability, susceptibility, triggered by environmental factors, especially toxins, as well as infections and allergens. They're heterogeneous, remember, they're not all the same. Various subgroups within each diagnostic category, as well as diverse contributing causing factors, right? Treatable, this is very important. For those of you who are here for the first time and have been told there's nothing you can do, they're treatable, remediable, and in increasing numbers of children, reversible, using biomedical treatment approaches coupled with other appropriate therapies, such as behavioral and educational. And remember, this is truly integrative. Prevention of these childhood disorders is the most desirable outcome, obviously, because you see, I show you the fetus being bathed in the chemicals. So this is going to probably, it's more than just the parents who have driven this whole thing really, and the researchers and clinicians like myself and my colleagues. This is going to require cooperation from government and corporations to really affect the environment. We have to decrease the exposures to ourselves, to the vessels that we carry our kids in, and to our kids. This is very, very important. So again, all of this is contained in Healing the New Childhood Epidemics. Okay, that was written a few years ago. Still very, very appropriate. I think when you're starting this can really help you. Hopefully, I've been always touched when I travel around the world that people will say, I had one. I remember somebody say, I saw your book in Punjab, India, and it was in the bookstore. And for me, you know, said it changed our life. And when you write a book, number one, you like it to be read, and number two, it really is profound. I have to say, it's profound when I have somebody come up to me and say at a conference, you changed my child. I never met the person or the child. You changed my child's life. So that's why I wrote the book, and it's very, very great.